Hi, I'm Eileen Carino with Pulse Center for Patient Safety, Education, and Advocacy, and I'm here with Nick Locke, the Program Coordinator at Washington Patient Safety Coalition, a program of the Foundation for Healthcare Quality in Seattle, Washington. Hi, Nick.
Hi.
We're just going to talk a little bit about what your organization does and what you do, and introduce the Take Charge campaign. So why don't you tell me a little bit, if you don't mind, what you do there and what your organization is about?
Great. So the Foundation for Healthcare Quality is sort of a neutral space for lots of different people involved in healthcare. So that could be providers, policymakers, and patients as well, to come together and collaborate on issues that affect healthcare quality and affect the outcomes that are really important to patients. And the Washington Patient Safety Coalition is one of our programs. It's a member-led program that tries to address specifically patient safety through member-led initiatives, educational content, and then trying to convene and make spaces for collaboration. And so what I've been doing at the Foundation and the Patient Safety Coalition is really working on our educational content. We're planning a Northwest Patient Safety Conference with British Columbia and the Oregon Patient Safety Commission. And we're just trying to spread the word, get patients involved with healthcare, and making sure that those who are in healthcare, whether that's providers or administrators, are really listening to patient voice and making sure that they're prioritizing patient safety over everything else.
So great to know that you're out there. I learned about you just recently, and I'm excited that you're part of the Take Charge campaign, a lead in the Take Charge campaign. Um, why is it Take Charge campaign important to your organization?
Yeah, I think just by our nature of being a patient safety coalition, we're really focused on patient safety and patient voice. And the Take Charge campaign does an amazing job of empowering patients to speak up when they're receiving care. It's important to make sure that patients feel like they're a part of their care team, not just going through the motions and having things acted upon them. And I think Take Charge reminds all of us that anyone can be a patient. And when we are a patient, we're still afforded dignity and a voice, and it's important that we use that voice to speak up for our own healthcare quality and safety.
That's great information. And do you have a personal reason, or do you find it helpful to you, your family, not just the organization, but individuals?
Yeah, definitely. I mean, I had an experience probably about 2 years ago now where I was sort of in and out of the hospital, in and out of emergency rooms. I was having really bad gastric pain when I was in my undergraduate degree in California, and no one really knew what was going on. And since I was away at college alone, I didn't have as many advocates around to reach out to. And so I was given different painkillers and I was given medication for ulcers. And finally, after probably 3 or 4 months of being in pain, I went into the emergency room one last time and they finally diagnosed me with gallstones.
Oh
And
my goodness.
it's unusual for someone of my age to be diagnosed with gallstones. So it took a really long time for them to find it. But I had just been going in and out of the healthcare system. And every time I interacted with doctors, I was in pain and really unable to advocate for myself. And so I think Take Charge would have been important steps to know for me to be able to be prepared, talk with my care team about what was happening, and possibly even bring an advocate who would be able to speak up for me when I couldn't. One of the great things about Take Charge is that there's 5 simple, easy steps that anyone can take to improve their healthcare outcomes and really work together with the care team. And I think it's important for us to know that these simple steps are things that anyone can do. And I'm really excited to be a part of promoting that for everyone.
Do you have a favorite step?
I think that my favorite step is step 1, completing your advanced directives. I think especially for me, it might not be something that I would think about at this point in life, but I think this past year showed that there's lots of unexpected things that can happen when it comes to healthcare. And if the advanced directive isn't completed, it's harder to get your voice heard when you need it most. And so I would say that's a step that I'm really looking forward to taking this year as part of the Take Charge campaign.
Nick, thank you so much for being part of the Take Charge campaign. Thank you for your time to talk to you, and I look forward to seeing you in the real near future.
Thanks, Eileen.